Hi, today I'll discuss something about a very common problem, cough. So, almost 70% of the patients come to me with cough. Cough is extremely common in children less than 5 years of age. Most of the time, this cough is because of viral upper respiratory tract infection, and they can be blocked nose, runny nose, cough. There may or may not be fever. These are all because of viruses, and there are several viruses in one season, so the child may get 1, 2 or 3 attacks in the same season also of viral cough and cold. And this cough and cold does not need any treatment. All you need to do is hydrate the child, make the child rest adequately, don't send the child to school, but do not give any kind of antibiotics, because this is very short lived and it is self limiting. All viral diseases mostly are self limiting. Hydration is extremely important for this child. Now sometimes a child can get as many as 5 to 6 such attacks in a year, and sometimes they may go even up to 10 such upper respiratory tract infections in 1 year. So, and especially so with the children who have just started going to school, so there they meet several other children, so every now and then they contract this and get viral upper respiratory tract infection. But that should not worry you, because it is self-limiting and the child will become all right in 5 or 6 days. But sometimes it can be bacterial also. So it can be pharyngitis, it can be tonsillitis, which gives rise to cough also. In that case, your doctor will see the throat would be red. In pharyngitis, it will be inflamed, the tonsils may be enlarged, there may be pus points. So in that case, the doctor may decide to give you the antibiotic. And sometimes antibiotics are needed when the cough is because of pneumonia. So the child may have cough, may not even have cough, but the child is breathing very fast and the child will definitely have fever. So there are signs of toxicity in the child, and that time only you should go to the doctor, and your doctor will decide to give the antibiotic. But most of the time, as I said, it is viral in nature, and several viral fever and viral upper respiratory tract occur throughout the day, but they are sometimes clustered during winter seasons and sometimes during the monsoon season. Now this cough is short-lived, but sometimes this cough can be prolonged. Say the cough was there initially and it continues for 14 to 15 days. Now this cough could be either because of asthma or because of rhinosinusitis. So if it is because of rhinosinusitis also, all you need to give is one anti-allergic, and if it is because of asthma, there is a proper treatment of asthma and you must go to the doctor. If the doctor hears a wheeze, then he or she will decide to give you the proper treatment for asthma. Sometimes this is because of inhaled foreign body aspiration. As I told you in my earlier video, that foreign body can mimic any kind of chest infection from upper to lower airway, and the cough may be prolonged. If parents have not seen the child inhale the foreign body, then this child will present just with unremitted cough. So one should keep in mind that there could be a foreign body inhalation, and especially so in a toddler 9 months to 2 years of age. Sometimes this cough can be because of tuberculosis, but in children, tuberculosis not always produces cough in children. Even the chest tuberculosis may not produce cough in children. There are other symptoms which would point towards tuberculosis. There could be weight loss, there could be persistent fever, there could be loss of appetite, there would be a history of contact of tuberculosis. So not all cough should be considered as tuberculosis, and we should not refrain from giving anti-tubercular treatment to the child unless we have really diagnosed tuberculosis, and there are several methods to diagnose tuberculosis in a small child also. Sometimes this prolonged cough can be because of some rare causes like persistent bacterial bronchitis, in which you have to just give a prolonged course of antibiotics. Sometimes it can be rarely because of the cystic fibrosis or PCD, that is ciliary dyskinesia. These are all rare kind of diseases. Sometimes it can be because of hypersensitivity pneumonia, but these are all very rare causes. Remember, the commonest cause of cough is viral upper respiratory tract infection. It usually does not need any treatment. All the child needs is rest and proper hydration.